Hi, my name is Dr. Jim, and this is our third video of our shoulder series. And today I'm going to be talking about rotator cuff injuries, so stick around. Alright, so the shoulder cuff consists of four main muscles that hold it in place. So those four muscles, the acronym for that is SITS. So they are supraspinatus, infraspinatus, teres minor, and subscapularis. So now the shoulder is a joint that is very mobile, very flexible, which is a good thing. Allows us to do a lot of range of motions, but unfortunately with that flexibility comes more chances of it being injured, vulnerable to injuries. So one of the most common causes of injury to the rotator cuff is overuse or repetitive motion, such as when you're playing baseball, you're constantly throwing with that shoulder, or tennis, volleyball, anything where you're using a lot of your shoulder muscles you can cause injury to those muscles, weaken them, and cause irritation, cause tendonitis, and lead to even partial or full tear of certain muscles. And some other things that can cause this is overhead working. If you're working overhead all the time, always reaching above your head, that's going to cause a lot of wear and tear on your shoulder muscles. And then if you're falling and on your outstretched arm and you're trying to brace yourself, that can also cause injury to the rotator cuff muscles as well. So some of the more common symptoms of rotator cuff injuries is limited range of motion, whether it's in flexion or abduction. That can you can have limited range of motion, or where it's hurting when you're raising it above your shoulder. You can have weakness when you're trying to carry things. Right up to a certain point, it just hurts. You can also have pain, just like a dull, achy pain, or pain when you're sleeping on that side. So those are all some symptoms that can occur when you have a rotator cuff injury. So rotator cuff injuries can have very similar symptoms to the other two shoulder injuries that I talked about, which is frozen shoulder and bursitis. And a lot of times these can coexist, making it difficult to diagnose sometimes. So some distinguishing factors of rotator cuff injury is if you have pain when you're doing certain activities. Let's say you're throwing a baseball and it's always hurting every time you're throwing it, that can be indication that you have a rotator cuff injury. And if you're working overhead, lifting things all the time, and it's always hurting every time you go above your head, that's also an indication. If you're having this popping and clicking, not to be confused with a grinding sound, that is also indication that you may have a rotator cuff injury. So I'm going to go over 6 exercises, stretches you can do to help decrease the pain, decrease tension, and improve your overall range of motion. So this first one, what I want you to do is, let's say this is your shoulder that's hurting, that's bothering you. What I want you to do is put your hand on your hip, in front of your hip like this, and you're going to lean your elbow against the outside of your elbow against the wall. So when you're getting this position, all you're doing is you're going to push against the wall this way, so towards you, the front of you. So you're just gonna hold that for about 30 seconds here, and you're gonna feel that stretch right in the back of your shoulder muscles here. And hold this for about 30 seconds and do this twice. And you can even do it on the other side too. It's helpful. It's a good stretch that stretches the muscle that you don't often stretch. So this next one, you can do this either seated or standing. I'm going to show you while I'm standing. I'm going to show you, demonstrate this exercise here. So what you're going to do is you're going to feel for your bone, your shoulder blade bone, right? You're going to feel this hard bone going across your shoulder here. And what you're gonna do is you're gonna go above it, You're gonna feel for the muscles. And once you feel those muscles, what I want you to do is use 3 fingers, press into it, and you're gonna roll your shoulder forward. So while I'm pressing on it, continue to press it, I'm gonna roll my shoulder forward. I'm gonna keep moving it around, rolling it forward, back and forth like this. Every time you roll back again like this, let go and press a new spot. And you want to do this about 10 times or as many times as you want. This is something that you can do throughout the day while you're seated at work or in school. And this is just going to stretch those supraspinatus muscle out. So this next exercise, you're going to need a towel. Either a towel about this length or a bath towel works. So you're going to start off with let's say this is my bad shoulder. So I'm going to use my good shoulder, throw this behind my back like this, and I'm going to grab it with my other hand. And when I'm in this position, what I'm going to do is I'm going to use this right hand and I'm going to pull up on this. Pull up on this and hold that for about 30 seconds. Go as far as you can. Only if you start to feel like there's too much pain, that's when you know you've gone too far. So this stretch is stretching out your infraspinatus muscles. So again, 30 seconds, 2 times. It's a good idea to do both sides actually. So this is something again you can do throughout the day as well. So this next exercise, you're going to use a towel again, and what I want you to start off with is just hold this towel about shoulder length apart. And you're just going to squeeze with your hand and you're going to pull apart. So when I mean pull apart, I mean you're pulling apart like that, okay? And you're just going to hold that. I want you to hold that for 20-30 seconds. And this is going to work the external rotation muscles. And this is something that you can do throughout the day too, if you have a towel handy. Now you can also use a resistance band, which will give a little bit more. And if you have a resistance band, you don't have to hold it. You can just go back and forth and do about 10 to 15 reps of these. So this next one, you're going to need to lay down on your bed or on the floor. So you're going to want to start off with by having your arm kind of about 90 degrees to your body here. So you're going to bend your elbow 90 degrees as well. First, you're going to bring your hand towards the bench or towards the bed as far as you can. So let's say this is as far as I can go. So what you want to do is just press a little bit on top of your hand here and hold that for about 30 seconds. Now, if you start experiencing pain, you've gone too far and you want to move it back a little bit more. So again, hold this for 30 seconds and then relax and do this for 2 times. And again, with this one, you might want to maybe just start off with once a day, and you can move to doing more reps as you gain more motion and as you decrease the pain in your shoulder. So this last exercise is an optional exercise because this one can be very uncomfortable and cause quite a bit of pain and even lasting pain that can last up to 24 hours. So this one, again, I want to warn people, is optional. It's not comfortable to do, but it provides so much shoulder pain relief and so much increase in range of motion. So I'm going to get right into it. So what you want to first do is, let's say this is my affected arm. You raise your arm up like this. And what you want to do with your right hand is you're going to put your thumb into your armpit, okay? And you're going to grab with your fingers, grab the backside of that muscle. So once you grab that, what I want you to do is you're going to apply pressure. You're going to apply pressure, and it's not comfortable pressure. And once you get good pressure, I want you to start your elbow. I want you to start your arm kind of right by your ears here, and then you're going to reach up. And then you're going to relax, and then just move on up. So what I'm doing is I'm continue every time I bring my arm back down, I'm moving my thumb and my fingers a little bit higher. So I'm gonna do this maybe 10 times, but you could definitely do this more if you can handle the uncomfortable pain, the pressure on your muscles here. So this is kind of working the subscapularis muscle, latissimus dorsi muscle. And this is a really good stretch for those muscles because they're very tight and they're very tense, and they have a lot of trigger points. So once after you do it, you do feel a big increase in range of motion again, like I was saying. So again, this is optional. If you feel like you can't do it, definitely skip this one. So that concludes today's video. So stay tuned for part 4 of our shoulder series. It should be coming up in the next month here. So thank you for watching. If you like the content and if you enjoyed the information that I've given you here, please like, subscribe, and share my channel. I appreciate it. And until I see you guys again, take care.